What is the safety profile for Xofigo? The most common adverse reactions in greater than 10% of patients receiving Xofigo were nausea, diarrhea, vomiting, and peripheral edema. Interestingly, grade 3 and 4 adverse events were reported in 57% of Xofigo-treated patients, but in 63% of placebo-treated patients. The most common hematologic laboratory abnormalities in Xofigo-treated patients were anemia, lymphocytopenia, leukopenia, thrombocytopenia, and neutropenia. Treatment discontinuations due to adverse events occurred in 17% of patients who received Xofigo and 21% of patients who received placebo. The most common hematologic laboratory abnormalities leading to discontinuation for Xofigo were anemia and thrombocytopenia, both approximately 2%. Can many patients tolerate Xofigo and the hematologic toxicities? So grade 3 and 4 adverse events were reported among 57% of Xofigo-treated patients. But I think most importantly, 63% of patients who had placebo had these toxicities. So this is a very tolerable agent. Xofigo, or Radium-223, is a radionucleotide. The U.S. Nuclear Regulatory Commission, the NRC, has given a recommendation for the use of Xofigo as an agent, a radiation agent in the United States. But does the NRC require individual oncology offices to be registered to possess and administer this agent? Radiation oncologists and nuclear medicine physicians have both the appropriate training and experience to access this agent. They will be the primary authorized users for Xofigo in the United States. Along those lines, are there perceived barriers for oncologists and urologists to use Xofigo now that the FDA has approved it? Additionally, does an oncology or urology practice need to have a radiation oncologist directly in their practice to use the therapy? Well, using our group as an example, at 21st Century Oncology, authorized users are part of the treatment team, and we work together on a regular basis as radiation oncologists and urologists to facilitate patient care in a multidisciplinary fashion. To that end, authorized users are already part of the treatment team and will help patients access this agent. Are there other perceived barriers for the use of Radium-223? Perhaps because previous radiopharmaceuticals have not been approved and this is a first-in-class agent? Well, we believe that this agent will be practical for the community. The companies which have brought it to bear have built it specifically to be practical for the community physicians who provide over 80% of care for patients with cancer. In addition, Xofigo will not burn bridges for potential future chemotherapy. As the pivotal Alsimca trial showed, the toxicity profile for Xofigo was minimal, and so patients will most likely be able to receive chemotherapy in the event that Xofigo fails them.